Well, good morning, everyone, and welcome to the Osher Center for Integrative Medicine Grand Rounds. My name is Peter Wayne, and I serve as the overall director for our center. I'm so excited for our lecture today by my esteemed colleague and friend, Dr. David Victorson. We're all in for a really special treat. And I'm also excited that this lecture provides an opportunity to publicly announce the launching of a new initiative at our Osher Center, centered around elucidating the links between integrative medicine and planetary health, and developing educational, research, and clinical initiatives that strengthen efforts to promote both. To serve as director for this initiative, we have re-recruited our former program manager, Ms. Atra Nusrat, who will now split her time overseeing our portfolio of activities related to integrative medicine and planetary health, while also serving as our overall senior program manager. To introduce Atra received her Master's of Science in Environmental Technology from Imperial College at the University of London, and then served as an environmental sustainability coordinator for 7 years in the nonprofit sector. In this role, she designed a socially and environmentally responsible initiative, which was recognized by the British Prime Minister's Office. After moving to the US in 2007, Atra worked in the environmental and personal development sectors, including supporting programs related to meditation and mindfulness. Between 2014 and 2020, she served as the program manager for the Osher Center, during which time she also gained certificates in climate change and health from the Yale School of Public Health and Harvard X. During her final year here, Atra helped rekindle my own academic interests in climate change, and together we co-authored an article called Integrative Medicine is a Good Prescription for Patients and Planet, which essentially outlines the purpose and vision of our new program. During her 2 years away from Osher, Ms. Atra worked with the local Colorado government, where she also oversaw a variety of environmental sustainability projects. I can't tell you how excited all of us here at Osher are to have Atra back as a core member of our leadership team, and especially to have her oversee our new integrative medicine and planetary health initiative.
Okay, thank you very much, Peter. I'm very honored and excited to be introducing Dr. Victorson. As Peter mentioned, with Dr. Victorson's presentation, we are launching a new branch of programming at the Osher Center, focusing on the intersection of integrated medicine and planetary health. So there's a growing body of research and evidence, which Dr. Victorson's presentation will speak to, about how individual and public health is influenced by and can be improved upon with a greater connection to our natural environment. And at the same time, we are both seeing and feeling the negative impacts on an increasing basis on our mental and physical health when our local and global environments are degraded. So through our new initiative, we want to explore and develop new programs and partnerships that can meaningfully increase theoretical understanding, embodied connection, and generate real-time impact involving the cultivation of healthy reciprocal relationships between our inner and outer environments. So to this end, we're very pleased that we've already started some conversations with organizations such as the Planetary Health Alliance, based at the Harvard School of Public Health, the Department of Organismic and Evolutionary Biology at Harvard University, and the Nova Institute for Health of People, Places, and Planet, and our very own Osher Collaborative for Integrative Health. And that brings me back to introducing Dr. Victorson to kick us off today. So thank you again, Dr. Victorson, for joining us. We're very pleased to have you. We're privileged to have Dr. Victorson deliver his particular presentation on Nature Nurtures, exploring the health and healing benefits of being connected to Mother Earth. And in terms of Dr. Victorson's background, he is a licensed psychologist and professor of medical social sciences at Northwestern University's Feinberg School of Medicine. He is the associate director of the Cancer Survivorship Institute at the Robert H. Lurie Comprehensive Cancer Center's Survivorship Institute. Dr. Victorson leads the Consciousness in Health Research Lab, where he conducts research focusing on improving quality of life and well-being for people affected by cancer and other life-impacting conditions, using contemplative, psychosocial, and biobehavioral approaches. Dr. Victorson is founding chair of the Nature and Health Special Interest Group through the Academic Consortium of Integrative Medicine and Health. He is also the co-founder and executive director of True North Treks, a national nonprofit that supports young adults and caregivers affected by cancer through connecting with nature, peers, and mindful awareness practices. And finally, Dr. Victorson is a member of the research faculty at the Osher Center for Integrative Medicine at Northwestern University, through which I had the pleasure of making his acquaintance. So thank you, and please welcome Dr. Victorson.
Thank you, Atra, Peter. It's an honor to be here this morning to help be a part of this new initiative that sounds incredible. I'm going to go ahead and share my screen. And I would just like to begin by stating that I have nothing to disclose. I always like to start with a few initial questions to the group. These are not to be answered necessarily, but just to be contemplated. Since you're here, it must mean that you are interested or enjoy nature or this field to some extent. So do you have a favorite type of nature? Something that draws you in and captivates your attention? Maybe sunsets or mountains or beaches or gardens. So think about the vast array of different natural environments, green and blue scapes. Are there any that particularly call your attention? When was your last experience in nature, when you were actually mindful of being in nature, that you experienced some kind of pleasant sensation or emotion as a result? What's the most regular or consistent kind of nature contact that you receive, if any? Might it be being in your backyard? Are you close to a forest preserve? Do you live in a place where you can get out of an urban environment, or is there a green space in your urban environment? And then lastly, how do you think that your affinity to spending time in the natural world could have a positive impact on the planet itself, if at all? So I'll leave those questions with you now, just to think about your own personal connection and experience with nature as we proceed. In the presentation today, the first thing that I'd like to do is just overview some theories of nature and health, as well as select and highlight some known benefits of spending time in green and blue spaces. Then I'll provide a working definition that we use to define nature, as well as a framework that is recommended to conduct research on nature contact and human health. I'm going to present some data from our group, from our nonprofit with young adult cancer survivors, just to show some of our initial benefits and findings of spending time in nature with this population. And then I'm going to end it with some questions on our relationship between nature and human health, and then how that might extend to the health of our planet. So over the past several decades, increasing attention is focused on this positive relationship between connecting with the earth, with nature, and with improvements in human health. Well, in terms of the kinds of research that we've seen over the last decade, we have seen an increase in small experimental and observational studies. Most of them have short-term outcomes. They typically are broken down into studies with active engagement of nature, people walking in parks, running, or other activities, passive engagement, where they might be resting outside or in a room with a view, or virtual exposure, where they're shown images of nature or watching videos. Few of these studies have been randomized controlled trials, and those that haven't really changed the overall findings. However, there are some exciting new RCTs in progress that are helping us understand the role of adding green space to cities, the benefits that we can have in our health through reducing air pollution, through planting trees, promoting physical activity, decreasing noise, and decreasing stress. All in all, however, the verdict at this point in the nascent stage of this field is that spending time in nature can be good for us. And many of us who do spend time in nature, that's not very revelatory. We know that we tend to feel better when we're outside and engaged in green and blue space. But the extant research to date has shown that spending time in these types of environments can affect a whole host of human health functions spanning cognitive, affective, social, physical, behavioral, and biophysiologic domains. And that it may also even foster certain ecologic sensibilities that promote us to safeguard the well-being of Mother Earth herself. Throughout millennia, ancient societies, they left signs and cultural artifacts that highlighted their vast interconnectedness and interdependence with nature, how it affected health and healing, but also sustainability, survival, and their spiritual affiliation. Connecting with nature for the transactional sake of health and health benefit is largely a modern pursuit. It's similar to what we've witnessed with the westernization of traditions such as yoga and meditation. Seeing nature in this transactional way is somewhat in contradiction to more traditional indigenous wisdom that nature itself is merely an extension of ourselves, of our bodies, of our minds, of our spirits, of our lifestyles, and of our ethics. There are some theories of why we might be affiliated and interested and affected by nature. One of the early theories is that of biophilia, which suggests that humans are wired with an innate affinity for meaningful contact with nature and things found in the natural world, similar to how we have natural fears of things found in the natural world. The notion of biophilia suggests that we have a genetic predisposition. We may be attracted to certain features found in nature that once were associated with our species' survival. So our fascination with large bodies of water theory suggests that it might be because that used to be where we could find something to drink. We might be able to hunt and find wildlife. It may have been a place for us to escape danger. Forest habitats could be used we could climb trees to evade predators or hunting and gathering. And vast open spaces and mountaintops could offer visual openness so we could see oncoming threats. So this biophilia effect in theory might explain why nature is therapeutic and also why our growing separation from nature could be emotionally challenging and even damaging to some extent. Another theory I'd like to just briefly talk about is that of attention restoration theory. This one is widely cited in the research by Kaplan. And it suggests that in addition to exposure to nature, to our enjoyment, that nature also has restorative effects in terms of our ability to focus and concentrate. And this theory proposes 4 stages that lead to restoration. The first stage is clearing the mind, where our concerns, worries, and negative thoughts are allowed to pass through the mind and fade away, not by our pushing them away, but by letting them flow through and out. As a mindfulness researcher, this sounds very similar to what one might do during a meditation. The second stage is recovery from mental fatigue, that following any activity that requires focused and directed attention, the mind is then allowed to recover to normal levels, when engaging in nature. They refer to soft fascination, where an individual can spend time in an environment that attracts us and is stimulating in a gentle way, where we can relax in a natural environment and reflect. And then that leads to the last stage they talk about, which is the most impactful for restoration, where we can spend extended periods of time in an environment that has the ability for us to simply take in and reflect. They also refer to the environmental quality. So they would suggest that this restoration occurs when our environments encourage us to be totally immersed and engaged, almost as if we're in a whole other world. And then another one is compatibility. So this is about feeling enjoyment and an affinity in our environment. So for an environment to be restorative the environment must also be one in which we choose and that is enjoying for us, versus an environment that isn't necessarily bringing us those. And then a third theory I just wanted to briefly touch upon is the psychophysiological stress recovery theory by Ulrich. And this theory proposes that when people are physiologically and psychologically stressed, that exposure to unthreatening natural environments can reduce our stress and have a restorative effect. In particular, this is compared to urban environments where they may not allow this, and they may hamper this restoration, recuperation, and recovery. Ulrich is known for a hospital study in the early 80s where they looked at the case notes of 46 patients who had received gallbladder surgery. They divided them into two groups of 23 matched for age, sex, height, health and weight, smoking. And then one group recuperated in a hospital room with a window view that overlooked an outdoor space. And then the other group had an identically sized room, but it overlooked a brick wall. And only records from when the trees would have had full leaf coverage were examined. And it was found that those who recuperated in rooms with windows looking at a natural scene had shorter postoperative hospital stays. They received fewer negative evaluative comments in nurses' notes, and they took fewer painkillers than those who were in the brick wall room. And so this experiment was repeated by Ulrich and colleagues, looking at printed images of nature, looking at including exposure to real and recorded birdsong. And all of these different types of exposures had similar findings on reduced healing times and physical discomfort by patient report. And then others have taken these findings and replicated them, looking at the sensory connection to nature while being in an indoor environment. So from seeing either through a window or in a picture or painting, hearing sounds, being able to smell and touch things found in nature has also been shown to have positive health benefits for hospitalized patients. Outcomes of these studies were mostly on mental health outcomes, decreased stress and anxiety, but also use of pain medications, blood pressure, as well as complaints, being tired, fatigued, etc. And then in one study that was recently published, they examined recovery rates of 80 women who underwent thyroidectomy, and they found that those in rooms with plants or flowers had significantly shorter hospitalizations. They used less analgesics, had lower ratings of pain, anxiety, and fatigue, and had more positive feelings and higher satisfaction about the hospital rooms compared to those who were in the control group. We also know that people who have access to nearby nature tend to report being healthier than individuals who don't have access to nearby nature, and that the long-term indirect impacts of this nearby nature include increased job satisfaction, satisfied with one's home, and satisfaction with life in general. In terms of more, I would call it deeper exposure into nature, there have been several studies out of Japan and elsewhere that have looked at something called forest bathing and other types of immersive multi-night experiences in nature. And a growing literature is showing that not only have they found mental health benefits of this, but that they've also found changes in immune system parameters, such as increases in natural killer cell activity, and as well with an effect that can lead up to a month out from their exposure. As a camper, one thing that I could relate with was some recent work published showing that a week of camping can reset the body's circadian rhythm. We know that the increased use of electrical light, reduced exposure to natural light has caused many of us to experience certain sleep problems and caused our natural patterns, our wake sleep patterns, to be off. And but what this study was hypothesizing was that our internal clocks would synchronize with a natural midsummer light dark cycle if we were able to. And they found that 1 week of camping outdoors was enough to reset this body clock to its natural sleep rhythms. Recently, colleagues found, Marcel and others found that in a study of 1,500 people, that those who took part in group-based nature walks, they reported significantly lower depressive symptoms and stress compared to the non-nature group walkers. And this was even after controlling for things like social support and physical activity, two things that in a lot of the nature work are hard to disentangle, because a lot of the interventions include movement and being with others, which we also know are really good for our health. And then recently, this was an exciting study by White and colleagues that showed that people who spent at least 2 hours in green spaces, in local parks or other national environments, that they were significantly more likely to report good health and psychological well-being than those who don't. So for those of us who would like to know how much do I need to get an effect, they said 2 hours. And what they also reported was that this 2-hour time was a hard boundary, that the study showed that there were no incremental benefits for people who didn't meet the 2-hour threshold. So if we were to set a nature goal, nature contact goal, this might be something, at least for us to begin to look at. We also know that not all green space is created equally. And with the rise in nature and health research and publications, it's also shown a sad and challenging light on the fact that not everyone has access to nature and to different types of green space. Millions of Americans lack access to this safe nearby nature. And we know that this can exacerbate health inequities further to groups who already have limited access, limited resources. What's really interesting is that exposure to nature disproportionately can benefit marginalized populations. There's a theory of equigenic, it's called equigenic theory, and it suggests that individuals with lower SES and with lower resources, those who might be more marginalized, traditionally less access, actually demonstrate greater benefits to a whole host of indicators that we're looking at in these green space studies than individuals of a higher SES. So if we are indeed finding a health benefit for being around green space, there's a call to action to make sure that everyone has equitable access to its exposure. I'm going to transition now to how we're defining nature. Tina Luberto and Karen Koffler and I published a piece in JSIM on nature as medicine, mind, body, and soil a couple years ago, where we provided a working definition of what we were talking about. I'd like to share that here now. So it's pretty comprehensive. So nature being an organic outdoor environment occurring either naturally or with human assistance, where the majority of ecosystem processes are present, from birth, death, reproduction, relationships between species. It could be any element or combination of this natural environment, including the spectrum of habitats and wilderness areas, so forests, mountains, deserts, prairies, as well as atmospheric and celestial phenomena, clouds, the sky, rain, sunlight, stars, sunsets, urban preserves, woodlands, parks, neighborhood vegetation, and horticulture, as well as personal or community gardens and yards. When we were coming up with this definition, we chose to exclude indoor nature just for the sake of what we were reviewing. However, as you saw from previous studies, there's a whole host of good and valid research that is showing that simply viewing nature from the indoors is also beneficial. But for our sake, we chose to confine it to things in the outdoors. We also made sure to limit it to animal contact. If because contact with animals is also another whole area of influence that we wanted to try to minimize, just in terms of what we were talking about here. Frumkin and colleagues have really helped us identify certain pathways by which we might encounter nature and recommend that nature researchers try to address these in their reporting of findings. So we can do a better job at identifying mechanisms of action, or at least identifying and describing what the sample experienced. And so on the y-axis, you can see the spatial scale. Is it a small scale from potted plants all the way to out in the wilderness? And then you can see on the x-axis the frequency by which one is engaging that environment. So is it occasional, recurring, routine, or outgoing? And then you can see, going out, into the wilderness might be more occasional, whereas if you're residing in a green neighborhood, that might be more of a regular thing. We took this model and adapted it to add a few additional layers, this matrix of pathways. So you can see on the left, the spatial scale. Is it small? Is it medium? Is it large? How frequently do you interact with it? We're also looking at the proximity. How close or far, how embedded is nature within one's community? And then what activities are involved? Is it sedentary, passive activities, or are they movement-based? I'm really interested in this one. What level of awareness is applied while in nature? Is nature the object of our attention, or are we simply walking and talking with a friend, not really paying much attention to where we are, or are we even looking at our phone and doing some scrolling? Does that matter? In terms of what sensory pathways are activated, visual, auditory, tactile, olfactory, gustatory, and then the level and type of contact we have while we're in nature. Again, are we by ourselves? Are we with others? If they're others, are they our friends, people we chose to be there with, or are they simply people walking past us, sharing the space? So there are a lot of things to think about when we use that word nature contact, that could have lots of influence over a person's experience. And these are some of the different pathways that we try to keep in mind. I'm going to transition now and move now into some of the work that we're doing with our nonprofit. I mentioned earlier that green space is not created equally, and that not all groups have equal access to green space. One group that I work with both in my research lab as well as in our nonprofit are young adults diagnosed with cancer. They have, compared to other groups of cancer patients and survivors, this young adult age range between 18 to 39 tends to experience considerable health inequities compared to younger children and older adults. Cancer is a terrible experience for anyone who hears those words, "you have cancer." However, for this group in particular, it's full of disadvantages for their optimal development during a period of time when they're launching. And so we like to say that when the lightning bolt of cancer strikes a young adult during this formative developmental period, the power can go out on their lives and leave them feeling very disconnected from the life they once knew, disconnected from friendships and other relationships, from their future plans, from fertility planning, constant fear of recurrence, fear of missing out, feeling bad about their body image, feeling isolated, financial toxicity, a host of physical and emotional side effects. We call this the adverse effect of disconnect. And it can leave many young adults feeling lost in transition as they move from the structure of a treatment facility into the wilderness of survivorship. And so we created True North Treks almost 13 years ago, where our goal is to help young adults and their caregivers find direction through connection. True North, as you may know, is unlike Grid North or Magnetic North, is the location of the North Star. The North Star, of course, has been used for millennia to help people cross featureless oceans without having a map. and help them find direction without having to rely on random chance. And so we use a similar metaphor where we help our participants connect with nature, connect with other people who get it, and connect with themselves. And I'm going to share in a little bit how we use this probably diagnostic of our Western approach to using nature, but how we work with and engage nature to help in this process. I'm going to write some call it the spectacular nature that our Western focus has tended to value. And we do this with True North treks as well, even though there are other ways to engage nature less spectacularly. If you think back to that attention restoration theory, they talk about getting away and being away and having space in which to reflect. And we abide by that, by the places that we take our participants. So I'm just going to scroll through now, and you can just get a sense of some of the different environments where we bring our participants. Generally, take them on week-long backpacking and canoeing trips out to Yellowstone or the Wind Rivers Range in Wyoming. We take them to the Green River of Utah, the Boundary Waters of Minnesota, Upper Peninsula of Michigan. Really, we like to go wherever we're going to run into as few other people as possible, where we can engage and appreciate in the quiet teaching nature of nature. While we're out in nature, we also unfold a curriculum of mindfulness and yoga, and also have lots of unstructured time where our participants can just connect on their own, in their own way. And so we've been doing this since 2009, and you know, one of the things that we've done since the very beginning is collect pre and post trek surveys on everyone. And over the last 5 years, we began adding, in addition to our own homegrown questions, we added some measures from the Patient-Reported Outcomes Measurement Information System, PROMIS, on depressive symptoms, anxiety, and sleep disturbance. And then in one season, I had some extra finger prick kits left from the lab, where we asked everybody if they'd be interested in having their finger pricked before and after the trek, so we could look at markers of inflammation. And I'm going to show some of those results to you now. These are just a couple of pictures of collecting blood spots out in the field. What's great about blood spots is they're very field friendly. You don't have to put them in a refrigerator right away. You can just dry them and put them into a plastic bag and put them into your refrigerator once you get back. If you're interested in looking in depth at our findings and at our description of what really happens on our treks with our participants, you can see an article that we published in the International Journal for Environmental Research and Public Health on this. But essentially, we looked at data between 2016 and 2021. The groups were comprised of mostly survivors, 157, as well as caregivers. We gave them the pre-trek assessment, and then this does not indicate randomization, but some participants chose to go on week-long treks in the backcountry, where they're camping every night, and their experience is comfortable yet primitive. And then we also, over the last 5 or 6 years, have begun offering long weekend treks at our nature retreat center, where people can sleep in a bed, they can use a bathroom. Most day activities are hiking or canoeing and out in nature, but at the end of the day, they're not having to sleep in a tent. And then after the trek, we give them the pre-trek assessment a few days upon coming home. And the majority of on average, our participants were around 34 or 35 years of age. They tend to be in their mid-20s to mid-30s. We tend to see more women than men on our treks. And in terms of cancer diagnoses, we tend to see more breast and hematologic cancers, which is also consistent with young adults themselves. I would say about 80% of our participants are white, and the rest reflect different groups of communities of color. And then our organization, like many other organizations, have been really trying in many different ways to increase our representation, not only in our participants, but in our guides. And it's no small task. The inequities of nature access that I talked about earlier, they have effects that can make some groups, I'm going to speak on average now, not be interested in what we're doing, or make us have to think more creatively about how we're approaching our offerings. And it can also change the lens of healthcare professionals who would automatically not assume or think that some groups of people might be interested in our programs. So we're doing work not only on our outreach, but on our messaging and communication to try and make sure that everybody gets a fair shot. In terms of our findings from this program evaluation, a first set of questions that we asked had to do with people's perceptions of connection with nature, perceptions of connection with other young adults, knowledge gained during their treks, and as well as efficacy, both about being in the outdoors, but also in being comfortable and confident in doing mindful awareness practices. And across the board, we found significant increases with large effect sizes on people's reports of how connected and efficacious they felt. And I have a few quotes just to highlight what this looks like. So one person stated that this experience has reminded me that nature calms me, helps me see things in such a real, raw manner. I relearned how much I love connecting with the outdoors, even dirty and smelly. There was something so pure and peaceful about the quiet of the river. The sights and sounds and smells of nature very much drew me into the moment. It also brought back happy memories from my childhood playing in the woods. It felt good to think about the timelessness of the woods, the ground, trees, and water. We also found significant increases in feeling more connected to others, other young adults with cancer and caregivers. This was the first time in 10 years that I allowed myself to be vulnerable, fully accept the process that cancer has been. I was finally amongst my peers. We saw significant, large decreases in symptoms of anxiety, depression, and sleep problems in our participants. Sleep disturbance had a more of a modest or a medium effect compared to our anxiety and depression symptoms. The participants stated this experience was, without exaggeration, life-changing. I hiked into the woods of Montana feeling ravaged by the physical and emotional toll of cancer, and I left feeling renewed, strong, brave, proud, and at peace. One of the nice advantages of using promises is it allows you to see different levels of severity and how those might change. And you can see at the pre-trek level, we had the majority of our people on a mild symptoms of anxiety category, with a few moderate, a couple severe, and a few within normal limits. And post-trek, those scores moved largely to the within normal limits category, more to mild, with even less on the extremes. And the same pattern happened with our depressive symptoms. You can see just a movement away from moderate and mild towards within normal limits. In that one season where we looked at changes in inflammation, this was a small group, by the way. This is probably 19 people in total who opted in to try this. So to keep that in perspective, we did see that interleukin-6 values did have a modest and significant decrease that had, and the decrease did reflect a clinically meaningful reduction. We saw a slight increase in C-reactive protein while both values were in normal range. One of our co-authors suggested that because CRP is a good indicator for muscle inflammation, which can happen through activity, hiking, canoeing, that we may also see some activation in the body that could lead to adaptive inflammatory responses from movement. So the jury's still out. There are other studies that have shown decreases in inflammation from nature connection. And I think that having lots of perspectives on the multi-level nature of nature's benefits is really helpful for us as a field. Really quickly, because our treks both included canoeing and backpacking. Some of the treks were a week long, some were a long weekend. Some were camping in the backcountry, while others were sleeping in a really comfortable bed in a nice retreat facility. We looked at whether there were differences there. So we saw no differences in our groups on our outcomes, whether you were canoeing or backpacking. No differences on these outcomes, whether you were on a week-long wilderness trek or a weekend nature retreat experience. We did see that survivors on the week-long wilderness treks did report higher increases in feeling connected to nature than those on the weekend retreats. However, to keep that in context, those on the weekend retreats levels were also quite high, but we saw slightly higher in those who had more prolonged engagement or exposure. And then also those who were in the retreat facility, they had less complaints of sleep than those who were sleeping out in the tent. So not very surprised about that finding either. Especially if you're not used to sleeping in a tent, there can be a learning curve for a couple of days where you get used to it, and you may not have the best night of sleep. I'm going to transition now to the part of my talk where I have more questions than answers, and would just like to leave you with some of these questions about, as we know that nature is a major health determinant for human health, how about for the planet? So the question is, can our increasing awareness on this role of nature and human health be extended to the health of our planet? And if so, how? Does getting out into nature really help us care more or act more proactively or pro-socially in defense against the abuse, the neglect, and the negative impact that our society, that big industry, governments, and systems are causing to our world? And one question that I and others have been asking is, would engaging in nature less transactionally, less as an external service provider, maybe more of an interdependent, reciprocal extension of ourselves, would that lead to our greater agency and behavioral change in pro-environmental stewardship efforts? If this matters, how do we shift our mindset? The question arises mostly because if we look back at our ancestral origins of connection with nature, only this time in history have we really begun to engage nature in such a transactional other way. Clearly, nature has always been relied on by civilizations for food, for resources. But the ways in which it was engaged was not quite so take care of me versus more of a reciprocal, harmonious relationship with the natural world. And so questions are arising about our Western mindset of how we engage nature, the spectacular nature, the nature fix of being in big and beautiful, green spaces, versus more of a seamless integration of nature into our everyday lives through our surrounding built environments and our nearby access to green and blue space. I don't have answers to these, and maybe if there's time for us to talk a little bit, I'd love to hear people's thoughts and ideas, but these are some of the questions I'd like to leave the group with. As chair of the Nature and Health Special Interest Group, I wanted to put in a plug that if you're a part of the Academic Consortium for Integrative Medicine and Health, to please consider joining our SIG. We have some interesting conversations, and it's a nice way to build community for this growing area. And then after I'll leave it now for questions and comments that people might have. Thank you.
Thank you so much, David. This has been a wonderful presentation. And we have lots of comments and questions from the audience as well. And I want to particularly thank you for that ending note. I think, we spoke about this a little bit in our meeting beforehand in terms of the mind shift that we may need to explore to change our relationship with nature. So Peter and I will be going through the questions questions. There have been many of them. I will pull up a couple. So there's questions about providing access in an equitable manner to people. And you've alluded to that a couple of times. So I'm going to look at, what is this one question? So are there notable variations in how people from different cultural backgrounds or SES view and plus valences in exposure to nature? And what would those imply for a model of engagement with nature?
That's a phenomenal question. And the answer, I think, is complex or multi-layered. There's no one size fits all nature for anyone. We also have to take in mind the fact that not all nature is good for us or safe, that there are ways we can engage nature that can feel very unsafe, whether it's being in grizzly bear country or experiencing a lightning storm, or having too much UV ray exposure because of the heat or the sun. And so we also need to keep in, and then lastly, if we're living in an environment that is violent, that is unsafe, it doesn't matter, well, I think it does matter how much green space is there, because that can change that. But as long as neighborhoods are unsafe to get outside, that's also an impediment. And so I from a cultural perspective, I don't know the answer to different cultural connections to nature. It's probably best to ask people within those cultures, and for us to really learn more from a SES perspective, from a how low of a socioeconomic status is a group or a community or a person. I do think that there are there can be some built-in barriers that have to do with first attitudes and identities. People either thinking that they're not a nature person because they've just never had access. They did not grow up going out on a hike or having a family vacation where they might go visit a national park. They may not have built-in green space in their surroundings. And so the whole concept of going out into nature doesn't seem like something that's either enjoyable or safe. And so it doesn't mean that it couldn't be. And so we should always make sure that we try to create pathways for people to at least get to say, to have an informed no versus a knee-jerk no based on certain assumptions they might have. I'm going to stop there because there are probably more questions and we could talk about that for a long time.
Yeah. And on a related note, in relationship to equity, there's another viewer who said that they're working with cities to green their city. And could you mention a few articles that might specifically target benefits of tree planting or naturalization in very urban settings?
Yeah, so there is, I'm going to see if I can find the authors here. There is a really cool new randomized controlled trial that is coming out of Louisville, Kentucky, the Green Heart Project. It's assessing diabetes, heart disease risk, and stress among 700 participants. They're looking at air pollution levels, and they're going to be planting as many as 8,000 trees, plants, and shrubs throughout Louisville neighborhoods to create an urban ecosystem that promotes physical activity and decreases noise, stress, and air pollution. And so this would be, if you went to greenheartlouisville.com, you could find out information about that particular research.
Thank you, Dr. Victorson. There's a lot of appreciation for your work with True North Treks. And a couple of people have asked, and I'm sure you have a website that people can go to find out how to sign up to the program. Is there anything you want to say about that to guide people?
Absolutely, thanks. True North Treks, one word, .org. And we're currently, we have a few spots open for participants. In September, we're doing treks all through the summer and into the fall. but there are a couple treks in Utah and in the Upper Peninsula of Michigan where we're still recruiting participants into those. So if you have patients or survivors that you're working with, to send them that website would be great. And yeah, please check us out and reach out to me if you're interested in learning more or getting involved in some way.
Thank you.
I'm wondering, Atra, if I can ask a question. David, thank you. And echoing what Atra said, what a remarkable presentation, and also just a way for us to launch this program. And I'm particularly touched by your equal curiosity about the reciprocity, what we get from nature, but also how we give back. And on your last slide, you touched on that, asking, how does exposure to nature then feed back onto our role as stewards? And we're really curious about that. And it's clear that participants in your treks and studies, and many of the people who've been part of the studies that you cited, are inspired, they're changed, they have an appreciation for nature. I'm wondering what we know about how that translates into making a difference for nature, being an advocate. I think you're aware of the work that Bruce Barrett has been starting in University of Wisconsin, where, like you, they're teaching mindfulness, but they're infusing that with awareness of climate change and planetary health. And their primary outcomes are, do they drive less? Do their electrical bills go down? Do their choices of food, which have impact on the planet, change as well? I'm curious about that edge of the reciprocity formula, what you can say about that, and then specifically what the role of healthcare providers can be in affecting that mindset and practical shift.
Yeah, no, these are big questions that I've begun to grapple with, and many others, and they're really hard, because when we think about some of the biggest culprits to our environmental planetary problems, yes, they are, you can trace them down to the individual levels of consumerism and eating the beef industry, or the fossil fuel industry, or other large industries. And then so on the one hand, while we're taught from childhood to recycle and to compost and to ride our bike and to do these things, there's also a message that says, oh, it's those actual individual behaviors actually aren't going to make much of a dent. It's actually, we need to make a dent at this huge macro level for us to really see any change. It can be somewhat disheartening and defeating when we think about it. It doesn't mean we shouldn't stop at the individual level. And to the extent to which people's engagement in nature can help them think of it more as a body part than an external thing that we're entitled to derive benefit from, is how I tend to think. So if we see our yard as ourselves, if we see our neighborhood as ourselves, we might be less apt to do something damaging to it or to care for it more. And so that's that mindset shift that I was referring to at the end, this reciprocal, how do we see nature less as an other and more as an us? And how can, what effects might that have? From a healthcare perspective, Peter, I think, we're getting into nature RX now, where physicians are prescribing green time. What if physicians prescribed earth care time? What if, the power of the prescription, what if we were in a place where it is going to be good for our health if we are good to our earth? So what if physicians actually, what if there was a way that could also be infused, into the overall messaging as well? Because right now the messages are more, you should, it's good for the earth, but if it came back to it's good for us if you're good to the earth message. I don't know, just some thoughts.
Fantastic. And we know from good mindfulness work that doing things for other people makes us feel really good. So maybe doing things for the planet is an extension of that. I'll pass it back on to Afra, but thank you.
Thank you, Peter. I think also just connected to what you're just saying, David, there was a mention in the chat about the spiritual side of connections with nature and the nature spiritual side of healing. So I think you're just kind of alluding to that and pointing to that. And I think that's what you were ending on, of like opening up that question. I don't know if there's anything more you want to say in relationship to that. The person was just asking, you know, can you say anything more about the spiritual side of the connection?
Oh, you know, at its base, I feel like that's where many people end up. So while they might feel better emotionally, if they let themselves really see it, it's that they feel held spiritually, and that nature for me is the ultimate holding environment if it's safe, and that it's constantly teaching and offering wisdom through, you know, if we think about just the attitudes of mindfulness as being connections to our spirituality, nature teaches letting go. It teaches impermanence. It teaches non-attachment. It teaches acceptance for things. And so wherever you look, if you let yourself see it, nature is teaching us and letting us, awe and connection. And so to the extent that those are spiritual variables, I think they are. It's omnipresent.
Thank you. So we are almost at time. I don't know, Peter, if you want to pull any more questions that you think would be great from the many that we've received.
No, I'll let you pick the last one if you want, but I also know that you have some outgoing statements to make. But I just want, while I have the mic, to thank David directly one more time. Thank you for all the work you do and the way you do it. You bring such a blend of passion to your work and care for the people you develop these programs for, and you bring rigorous science and awareness of the health of the whole system, and that's really special. So thank you as an individual and as a colleague. We really are grateful, and I can't think of a better person to launch this program, so thank you.
My pleasure and my honor. Thank you both. Really appreciate it.
Thank you, Dr. Victorson. I echo everything Peter said. It's wonderful to have you here. So I will finish on a few announcements, but I also want to respond to the many questions that come in, that we will respond to them that have been posted both in the Q&A and chat. If you haven't had a chance to kind of post anything, then do so. I know people are asking for a lot of resources and whether there are other schools and programs and that they can learn about. So we'll do a little bit more research for you as well and respond and post them on our website. So lastly, just to close, I just want to make a few announcements about our upcoming grand rounds. Next month on August 2nd, we have Dr. Scarlett Soriano. She's a newly appointed executive director at Duke Health and Wellbeing, and she's going to be presenting on innovations in integrative medicine. And then on September 6th, we have Dr. Gurjit Bardhi, who was recently appointed director for the Osher Center for Integrative Medicine at Vanderbilt University. He will be giving a research presentation entitled Stretching Breath for Health. And lastly, I do want to just remind people that we are going to be holding our 5th biennial Integrative Medicine Network Forum this year on November 10th and 11th. It's going to be a 2-day conference this year, and it'll be fully virtual, so you can participate from wherever you are. The theme of this year's conference is the lived experience of depression and integrative approach. So please keep an eye out on our website for more details and on our newsletters. And you can learn about all of our programs, previous grand rounds, and even make a philanthropic donation on our website at oshercenter.org. So thank you again for joining us. Thank you, Dr. Victorson, for a wonderful presentation and for launching our new initiative in integrative medicine and planetary health. It's been a wonderful presentation. Everybody has appreciated it. Thank you.